happens to welcome everyone to this event, which happens to take place on the International Day of Action for Gaza and the prisoners. Salam wa hub lil jamia. My name is Lama Khouri, and I'm a co-founder of the Palestine-Global Mental Health Network and a member of the board of the Gaza Mental Health Foundation. A more detailed biography will be provided in the chat. I am honored to be hosting the meeting today. Hosting the meeting with me are my colleagues Vivian Abu Alloul and Fida Alian. I'm speaking to you from New York City, which is part of the traditional territory of the Lenni Lenape. I acknowledge the indigenous people of the land as its past, present, and future stewards. A few housekeeping matters to note. As you saw when you entered the meeting, this meeting is being recorded. You entered the meeting muted. The unmute feature has been disabled to prevent disruptions. However, you are encouraged to post comments in the chat. We gather here today as the genocide of our people in Gaza is in its 10th month. We are witnessing a level of brutality and war crimes that never in human history has it been witnessed live stream. During our meeting today, we will explore the mental health repercussions of these atrocities on the people of Gaza and the heroic emergency response by the Gaza Community Mental Health Program, GCMHP. Details about the foregoing are available in the GCMHP's recent report entitled 9 Months of Israel's War on Gaza, the Mental Health Impact and the GCMHP's Response. A link to the report is posted in the chat. This event is hosted by 3 organizations: the Gaza Community Mental Health Program, the Palestine-Global Mental Health Network, and the Gaza Mental Health Foundation. Links to the websites of the 3 organizations is posted in the chat. Today we mark 301 days of genocide in Gaza. We are faced with harrowing statistics. More than 40,000 Palestinians have been killed, including more than 15,000 children. 19,000 children have been orphaned due to the killing of their caregivers. Every day, 10 children in Gaza lose a limb. And we are told the amputations at times are done without anesthesia. Every wound in Gaza is at risk of infection, and every child in Gaza is in dire need of mental health support. We have exhausted every word, every adjective, every image to convey the painful reality of the genocide in Gaza, a situation unparalleled in its devastation. We recount statistics that numb the mind, see haunting images, children lost to Israel's brutal assault, bodies torn apart, families forced to move from one ruined city to another under relentless bombardment, carrying the elderly and the few possessions they've managed to salvage. The people in Gaza are left without medication, food, water, or sustenance. Diseases are rampant, and they watch each other succumb to starvation and illness. For those of us who hold Palestine and Gaza dear, who find these atrocities unbearable, the emotional toll is profound, even from the safety of our homes. What then is the true scale of the suffering for the people of Gaza? More crucially, what actions have been taken, and how can we support the valiant individuals on the ground performing this heroic work? These are the questions the report addresses. I will give a synopsis of the report. And Vivian, let me know when the slideshow is ready.
Okay, give me 1 second here. Okay, Lama, we're ready.
So slide 1. The drawings you see have been made by children who received services at the Gaza Community Mental Health Program and posted on their website. Heart-wrenching images. Even before October 2023, numerous reports pointed to a dire mental health situation in Gaza due to prolonged exposure to traumatic events and harsh living conditions. Slide 2. Palestine had one of the highest levels of mental health issues in the Eastern Mediterranean region. Some 543,000 children were already in need of mental health and psychosocial support services, and 2/3 of the population showed signs of psychological distress. Slide 3. And now to the present moment. GCMHP observed 3 prevalent emotional responses among the people of Gaza: anticipation, denial, and anger. They ask, how's my home now? What will my home look like when this war is over? Is my house still standing? Many believe that this is just a nightmare that should end or that is not really happening. People are infuriated and find it easy to encounter problems with each other, expressing frustration about everything and questioning, why is this happening? Why does no one care about us? Why have there been so many days of this with no interventions? Slide 4. And now the children. And I'm sure what I'm about to describe, you've seen images of what I'm about to describe. Most of Gaza's children suffer from fear and anxiety, lack of sleep, and show other signs of distress, such as constant shaking and bedwetting. Palestinian children who live in constant fear may suffer from prolonged anxieties and develop psychological responses to stress with long-lasting effects. Slide 5. What has the Gaza Community Mental Health Program provided so far? And I truly find it incredible that they were able to do all they have done under the circumstances. So during the last 10 months, GCMHP has expanded its services to address urgent needs. These services include psychological first aid, community awareness and counseling, specialized mental health services, supportive professional supervision, and networking with other providers. Despite losing 2 of its 3 facilities, GCMHP has managed to serve nearly 16,000 individuals. Slide 6. And now to end on a somewhat hopeful note. Despite these grave circumstances, with adequate support, these negative impacts can be reversed. Appropriate interventions can offset the impact of the war, assuming that safety, security, and nurturing environments are restored. And the slideshow ends, Vivian. So before October 7, I worked with clinicians from one of the 3 empowerment groups in Gaza called Aisha. The center is called Aisha. And I need to acknowledge the clinicians in Gaza whose dedication to serving their people under incredibly challenging conditions, and that's before October, is exemplary. These professionals exhibit a level of commitment, expertise, compassion, and professionalism that demand our highest respect. They have done so while enduring the same traumas daily of those they serve. During the last 10 months, GCMHP has lost members of its professional family. I will name the members, some of whom I worked with and greatly admired. Lamia Nasser, a psychologist and a beacon of hope, is known for her vibrant spirit and deep commitment. She was 28 years old when she was killed. Dania Yasser al-Hassaina, a psychologist. She and her family were under constant bombardment, and she kept texting us, letting us, asking for help. Dania was 25 years old when she was killed. Fatima Awaida, a psychologist who worked with the program since 2014 and was a mother of 2 girls and 1 boy. Nisreen Jarada, a psychologist, joined the program in 2022. She was 28 years old when she was killed. Hanan Ahmed, a psychologist, provided psychotherapeutic sessions to victims of torture and human rights violations. She joined a PhD program before October, and she was 31 when she was killed. Other GCMHP members lost children and family members. A female administrative assistant was moderately injured with her family, and her daughter was killed. Let us now take a moment of silence in memory of the tens of thousands of martyrs in Gaza. I would like now to introduce our speakers. Dr. Yasser Abu Jamei, a highly esteemed psychiatrist and Director General of the GCMHP. He has been a pivotal figure providing mental health support in Gaza. As a successor to Dr. Iyad Sarraj, who founded GCMHP in 1990, Dr. Abu Jamei emphasizes the vital connection between mental health and human rights, and has been leading GCMHP with deep wisdom, dedication, and compassion. Dr. Abu Jamei's perspective challenges the often glorified narrative of mere endurance and highlights the heavy toll that sustained conflict exacts on the people of Gaza. His commitment to, quote, healing the soul and instilling hope, end of quote, is evident in his interaction with the community, such as when he encouraged a group of children by saying, "You can smile." A simple yet powerful reminder to the resilience and hope he strives to foster. Dr. Abu Jamei, his work has earned him international recognition, including the Community Resilience Award from Rebuilding Alliance in 2021. His dedication to mental health and human rights continues to inspire those around him as he tirelessly works to bring hope and healing to a community under constant strain. Gwyn Daniel is a family therapist living in Oxford. She is a steadfast ally and a vocal critic of Israeli policies. She has been a pivotal figure in the UK Palestine Mental Health Network, often organizing and sharing Café Palestine and other public events. Gwyn has been involved for several years with the UK group supporting the clinical teams of the Palestine Trauma Center in Gaza, including the past 10 months. Gwyn has written many important articles in which she challenges the Zionist rhetoric that dehumanizes Palestinians and confronts the various ways our voices are silenced and our narrative denied. And I strongly encourage you to look for her articles. On a personal level, Gwyn has had a profound impact on me. Her gentleness, unwavering support, and insightful articulations of our struggle provide a source of strength and guidance. I often reach out to her for wisdom and courage to verbalize my own. On behalf of many Palestinians, dear Gwyn, I extend our deepest gratitude for your unwavering support and solidarity. Your contributions have been instrumental in our journey toward liberation, and your voice continues to be a beacon of hope and determination. And thank you all for listening. I'll turn over the mic to Gwyn and Yasser, who will now discuss the report.
Thank you so much, Lemma, for your incredibly generous introduction and for sharing the report so beautifully. Just before I turn to the conversation with Yasser, I wanted to add a couple of personal responses to the report. The first one is just the continuous shock and horror at how long this terrible genocide has been going on. Hearing 9 months of assault on Gaza, we now are into the 10th month, and that sense of shock continues to reverberate. The colleagues that I speak with in Gaza speak about the sheer exhaustion that people feel after 10 months of heroic struggle for life in the midst of death. People are saying that the recent weeks have been as bad as the first weeks of the war. And this reminds us that in the immediate aftermath of the onslaught, more bombs were dropped on Gaza than during the whole of the 2014 onslaught. That was in the first 5 days. And as our colleague Dr. Samar Jabbo reminds us, that level of what we must call overkill, as well as the obvious physical consequences, instrumentalizes trauma in order to produce frozenness, confusion among the survivors, and as an attempt to fix people in paralysis so that they will not dare to challenge the status quo. Well, that may have been the intention, but as we all see, it is not happening. And just as the worldwide solidarity movement has been activated and galvanized as never before, so the people of Gaza are continuing to resist by whatever means they have available to them. And nothing speaks more to the refusal of impotence and passivity than this amazing report, which lays out in full detail, as Lemma has described, the impact on the mental health and the livability of the citizens of Gaza. And most importantly, as Lemma has said, the heroic efforts of the Gaza Community Mental Health Programme teams, who in the midst of their own losses, their own dislocations, their own struggle for survival, still fulfill their professional mission. So now I'd like to say what an absolute pleasure it is, Yasser, to be in conversation with you. Maybe the word pleasure is not the right word, because what we're speaking about is so utterly grim and horrific. But I do want to say it's an honor and it's a privilege to be in conversation with you. We in the UK Mental Health Project have admired you for so long, and we've always looked upon you as a steadfast, a generous colleague who absolutely gives us the motivation to keep going. And I've thought in more recent years, I've thought of you so much as a dear friend. And in welcoming you, I also want, if there are any members of your team, Yasser, who have been able to connect to this call, I would like to extend a very, very warm welcome to them and to salute them for what they have been doing. So maybe, Yasser, before we speak about the report itself, I wonder if you could just share with the audience why you think that in the middle of such devastating assault on life, on the sheer struggle for survival, the struggle to find shelter, food and water, why you think at this moment it is so important that we keep mental health at the foreground of our thinking. Perhaps you can share some thoughts about that.
Thank you very much, Lemma. Thank you very much, Gwyn. Good morning, good afternoon, good evening, everyone. First, let me begin by thanking the organizers who have really put huge efforts in this webinar to see the light, and to thank the audience for their presence here today with us. I see many of the names who are very dear friends, and most of the people, if not everyone, are members of the solidarity groups who are supporting Palestinian people all the time. And if they are not members of the solidarity groups, then they are Palestinians themselves. So welcome everyone one more time. And before I go to answer the question, I would really begin by sending my gratitude to all mental health workers who work in Gaza Strip, especially those who work for the Gaza Community Mental Health Program. Without their sacrifice, without their dedication, we wouldn't really be here today. I'm so proud of the team of Gaza Community Mental Health Program, and we hope to be able to continue to serve the community in Gaza Strip. In previous attacks, we used to tell our teams that let's wait until the war is over and until the ceasefire is reached, and then we can start the intervention. We used not to advocate for intervention during the offensive time or the wartime. And that's because of many reasons. Among them, we think that the security of the staff, the safety of the staff is of major concern. But also we think of secondary traumatization because they are living under the same circumstances and they have to leave their kids during the attack time. So it's getting more and more difficult on them. And third, we thought, it's very hard to try to accommodate people, try to help people cope when the bombardment is happening, when the things are worse and worse, when there is no feeling of safety or security. However, this time things are really different. From day one, we felt it's different, and this is for many reasons. On top of them is that the society was already at the edge. Severe socioeconomic conditions, the level of poverty, the level of unemployment, the psychological, studies that looked into the psychological well-being of the population, it clearly showed that the population is already very fatigued and very vulnerable to develop further psychological issues. And then the severity of the attacks. Things were extremely severe. The bombardment was extremely severe. The displacement was extremely severe. And at the same time, most of our staff were displaced from day one, and they were already involved with helping the people in their displaced areas. So a couple of or a few weeks after the October 7th, we decided that let's plan our work, let's think, let's decide, let's plan what we can do. And let's try to join our efforts to help our clinicians work and try to reorganize ourselves in GCMHP. And that's how it began. And our thought also that our intervention, if not therapeutic, then at least could be of a very preventive type. How many children we can wait until a ceasefire is reached? And it seems that we were right. Already 10 months have passed, and the bombardment continues to go on. People displaced for the 7th, the 8th, and some of them for the 10th time is still happening. The losses of life is continuous. The dire conditions are getting worse and worse. More illnesses are anticipated. Now they talk about polio. So these issues will definitely have more severe impact on the psyche of the population. That's why we thought let's start as early as possible. If we are not going to heal people, then at least let's prevent the deterioration of their mental health well-being. And here we are. And the report shows some of the activities that we have done, and it illustrates parts of the psychological impact on the population.
Thank you, Yasser. And I guess we can't speak about this without thinking about the complex intertwining of the physical impacts of the genocide on all the population, of the levels of starvation, malnutrition, disease, as well as horrific injuries, and how will those intersect with the mental health impacts? And that's obviously a huge part of how you and the team are thinking in your responses.
Well, you know, we are dealing with things that we never thought that any human being should be dealing with, you know, even under the circumstances of war or genocide or whatever, you know, because who would imagine really that a place like Gaza Strip will be starving, you know? We never thought of that, you know. Even during the, when the Israelis used to destroy even the corpse and the farm, I mean, it was still there, even with 33% of the population below severe poverty line, still starvation was not an issue. But clearly it was there from the first week, the second week, you know. Starvation meant that we were looking at ourselves. And as I told one of the friends that, you know, if you miss someone for like a couple of weeks and then you meet again, you look that you have grown 2 or 3 years older, you know, you have lost a couple of kilograms at least, you know. And it was really interesting to look at each other whenever we meet each other because it was obvious. But the worst, and above all, looking at our children, you know, who are just not gaining weight, but also losing weight. And that was something that is devastating, you know. I am a physician, of course, before becoming a psychiatrist, and I understand very well how that would impact the growth of the children, and also their ability to learn, their ability to deal with things, their ability to cope. Good nutrition, good food is essential just to survive and to go on with their life. And then at the same time, how difficult it was for parents, especially for mothers, to be able just to make a meal for their children, for their family. And we have seen photos of many of the people who are just depending on wood or depending on papers who was burned in order to set some fire in order to cook something, which is almost maybe just little vegetables or something like that, like this. So starvation was really a severe issue. Another big problem, which is the hygiene. I mean, sanitation is another difficult issue. And while in January, February, we started talking about hepatitis and about jaundice, nowadays, unfortunately, we speak about poliomyelitis. Imagine, I mean, a place like Gaza Strip, when the vaccination used to be around 99% coverage, we have we are now afraid of polio. There were some vaccinations in March and in April. The ONOSA is about 70 to 80% of the children who are vaccinated, but still we speak about 30% remaining, which means more than 300,000 children. Let's keep in mind all the time, when we talk about Gaza Strip, we talk about 1.1 million children at least. So in addition to the bombardment, to the killing that was happening through the direct exposure to bombardment or the destruction of houses, there are many other things that were affecting the population. And they were putting a huge impact, psychological impact on the people, because even if you had money, you wouldn't really be able to buy food. And if you don't have money, then it's really worse and worse.
Thank you. And you mentioned the enormous threat to hygiene, and thinking about, as well as the dire physical effects of that, also the psychological effects, perhaps for women in particular, because of the destruction, the undermining of any sense of dignity. And dignity obviously is incredibly important.
But you know, we as Palestinians have our rituals when it comes to many things, and on top of them is really to live in a clean space, you know. And it's not possible, it's not allowed, you know, for a house to be not clean, you know, or for the last 10 months for a tent not to be clean, or for a stay place not to be clean, you know. And this is something that people were feeling ashamed of most of the time, that they cannot really exercise being clean because you have only one set of clothes. Many of the people were displaced more than once. For example, the most recent displacement was in areas in East Khan Younis, about a few weeks earlier, it was the displacement of people from East Gaza, like Shijaiya and Zaytun areas. So these people who were displaced more than 3 or 4 times, now they are getting back to their homes. 70% of the houses, according to the reports, or 80% were destroyed. So they just stay near their houses in the rubble. They just established tents maybe for the 3rd or 4th time. And when they had to run to Mawasi area, and yesterday they started to return back, some of their tents are gone, burned or destroyed, or some of the houses were further destroyed. And then how you can maintain a good space when the clothes of the children look dirty? How would a woman looks into the face of her, cousins, of her like sisters, of her relatives? And at the same time, we understand the impact, the health impact of not being wearing good clothes, of living in somehow contaminated areas. Sewage is a big issue. The treatment of the sewage was almost stopped most of the time. And that also made it further complicated for the health system to work. The availability of health interventions were markedly really worse and worse, not available in many of the cases. And let's keep in mind that the areas of Gaza Strip and the North Gaza, they got the worst because they are living under such conditions since October the 7th, maybe in Khan Younis since December, maybe in Rafah since maybe April. But again, people in the wars, they have seen it all, and it was worse and worse. So the question is, what can women do? Another part of it is sharing. A very important part of our life is sharing. We tend to share things. Whenever you have even 1 kilogram of onions, for example, you share with their neighbors. That's how things are, And that's the feeling of collective support, when we support each other. A big part of that is already gone because there is almost nothing to be shared, And recently, the people are sharing 1 cucumber, a couple of tomatoes, that we can all have some salad for a few for 1 meal at least, So the issue of dignity is a big one. And then one more thing: when you live in tent, you don't have a sense of privacy at all. You don't feel that you are in a confidential place at all. Whatever you talk, it's heard around, One of the ironic things that we kept hearing in November and December was coughing, Everyone was coughing, You heard it from all tents, And then later in February or in March, the whole neighborhood looked yellowish, Jaundice was everywhere. So this feeling that there is no sense of privacy is a big issue. And then the shelters. Shelters, they are schools who were at least having more than 3,000, 4,000 people. Or women were and girls were sharing the rooms. Men and boys were just sitting outside, and thousands of women were sharing 8 or 12 toilets. And let's keep in mind that water was available in most of the shelters for 2 hours per day. How could they manage? How could they continue? How could they clean their younger children? And I would add one more sentence. Sorry for the long answers. But I heard yesterday that 30,000 new borns women gave birth to 30,000 children over the last 10 months. Well, this is great news, but let's keep in mind how these women endured that giving birth. Where did they give birth? How were the conditions at the hospitals? And then how did they manage to feed their babies? How they managed to find clothes for their babies? How the babies survived this whole 10 months without proper place to stay when the temperature in the tent is usually 10 degrees centigrade above the normal temperature outside in the sun, and 10 degrees lower when it's in the cold weather. So, it's really devastating. And what can they do? You don't have, you have only one set of clothes, you have to live with it. Can you clean it and then put it on again and then stay in the tent when it gets, let me say, dry? That's what most of the women do. What else we can do? Nothing really can be done. Clothes were allowed to get into Gaza Strip only through some support from some major donors like UNICEF and like but it was coming for how many? For 1 or 2 times? Was it enough for the whole population of 2 million people? Of course not. Of course not.
Thank you for sharing that, because I think that again digs into some of the details, the fine detail of human life, which people may be less aware of. All the details of the debilitation, deprivation that you've just mentioned. I wanted to come back to the 3 emotional responses that Lemma referred to on one of the slides, which were anticipation, denial, and anger, and just maybe to look at those again in a little bit more detail. In the report, you wrote about the anticipation of fear about where to live, what the fate of one's home is, and that comes across incredibly powerfully. And I believe also that your own home has been destroyed in Gaza. And I wanted to just ask a bit further about how you think the worry of the fate of people's homes is connected to the ongoing community trauma of the Nakba and the anticipation and fear of a second Nakba.
You know, in 2014, you know, we at the moment we used to compare things to 2014 because 2014 is a major event that happened, and it's the largest until October the 7th. We were seeing people, you know, carrying some of their like furniture on their heads, some of their clothes, and moving from the eastern side to the western side, and everyone was saying, "Look, it seems that this is how people during the Nakba were doing, you know, just moving from one place to the other, carrying whatever they could carry, whatever, or everything that they can carry." But in 2023 and now, people say that our experience now is definitely worse than what was happening during the Nakba. And they just immediately compare it to the Nakba, and they just said they say some sentences. For example, the level of the destruction of the houses. I mean, during the Nakba, people were killed, they fled their houses, but the machinery was not the intention to destroy the houses. You know, of course, some of the villages were swept. They were not anymore there, but what happened now in Gaza, a place that has a population of 2.3 million people, 80% or 70% of the houses are gone. You can imagine how many units were destroyed. You know? So we were seeing it with our eyes. The home is everything that you have. You know, Palestinians are like people on the globe, everywhere. We human beings, we share the same hopes. We have the same wishes. We have the same life plans. We have the same struggles. We have the same achievements. We are not different from people in the States or in the UK or in Europe or wherever, you know. First, you dream to have a good family or a good job. You build your own career, and then you think about planning something for your children. You are lucky, you get the children, you think about their schooling, you know, you want them to have good education, and then you want them to become good enough to have good marks in the 12th grade, and then join university and go on with their life. And central to this whole dynamic is a place of living. Where are you going to live? You know, it's the address, it's the country, it's the place, and it's the house itself, it's the home itself, it's the flat itself. We Palestinians have chosen to stay in Palestine. We have chosen to be in Gaza. It's very clear all the time. Even when people had to leave in some previous offensives, they returned immediately. Even in some of the wars, people who were getting back into Gaza when the borders were open were more than the people who were leaving Gaza. But then the central part of it is home. It's where you grow, or where you have invested all your income for years in order to have your own space. And in my case, and that's for most of my colleagues and for most of the Palestinian people, it takes you 3, 4, 5 years just to have your own space. It takes you another 2 or 3 years just to buy the furniture, to maybe get rid of something old and buy something new, and then you will have maybe after 7 or 8 years of investment. And investment, we mean that you save all your money. You even try to save some of the money and you don't spend unnecessary expenses. This is all human. This is all us. But suddenly that house is gone. For some of the colleagues, they have lost the house and they lived there only for 1 month. And I know a couple of colleagues who lost the houses they paid on a loan, and they took a loan, and now they are on bank loan on their wages, on their salaries, and for the company that owns the building. So that suddenly is gone, and with it goes all the memories, because the little things that you have are inside their house. It's in the walls, it's on the walls, it's in the furniture itself, it's in the blocks that there. Everything is in there. Suddenly, you have to flee, and nothing is left there, and you are left not there. That's why a big question that happened to the people is what happened to our houses. That destruction was so massive that immediately the one would think, is it still up there or is it still not up there? In my case, it's really interesting. All the people who knew the area, they were telling me, your house is still up. You and a couple of your cousins, it's still up, it's still up, it's still up. And it was something to cheer and to, like, they were, hey, congratulations, doctor, your house is still up. And that continued until even when the Israelis started the land operations in Khan Yunis. I live in the very eastern side of Khan Yunis. And that continued to be until the very last day when they said we are going to withdraw from Khan Yunis. They just destroyed the 3 houses on the very last day, and they were gone, And that was something interesting, why they are destroying the houses on their way out, It's really strange. We thought that they would maybe burn it, but it was gone, it was destroyed. Until now, we cannot really comprehend or understand or really how much we have lost. And I don't think that we, as Palestinians, understand how much our losses for the time being. We are still watching what happens around us, what happens to the people who is killed every day, who is wounded, who is injured. And we live to struggle with where can we go, where should we go? So this anticipation is not for only our belongings, what happened to them, but also where should we go? And now a big question to everyone, if we are asked to evacuate, where to? Where can we go?
And I guess that really connects very much to the theme of denial, the difficulty of simply comprehending the scale of what is happening. And I suppose I was thinking about denial, and denial in the moment can be a very functional response to such extreme trauma. The need to dissociate, to try and create some alternative reality, the desire just to only deal with the things that can be dealt with. But I wonder whether denial is also, in some ways, a powerful part of resistance, that it is a refusal to allow the aggressor to determine the narrative. And I wonder whether you could say something about that. All of us might think that in the long term, psychological numbness is not going to be helpful to people if it means shutting off emotions for a long period. But I wonder whether you think that denial has some use in the moment.
No, there are some terms that sometimes are similar, but in the same time, they are very different. Sometimes we speak of denial, and it's more of a psychoanalytic, perspective. It's something that is not felt, something that happens. Sometimes we speak of it as emotional numbness, that people are not responsive anymore to the stressors, for example. Sometimes it's called by different people, even resilience. I think resilience is part of it, could be, I don't know if there is a big difference between resilience or between, when you see someone who have endured all of those difficulties and still going on with her life or with his life. Is it really resilience or is it really something else? Is it that they can't take it anymore? There is nothing in their hand. But at the same time, I really don't want to believe personally that the whole world is now watching what's happening in Gaza for the last 10 months and doing nothing about it, really. That's my way of helping myself. I can't imagine that more than 40,000 people got killed in Gaza, more than 17,000 children, or even more than that, but 17,000 children became orphans. And the world is just silent about it. Something is wrong, I mean, I lead a civil society organization. We were training people, teaching people on human rights, on the respect of human rights, on dignity, on confidentiality, do no harm, very simple, basic things. We were even talking about the social rights of the people, socioeconomic rights of the people. Gender mainstreaming is something that we enrooted in our GCMHP many years ago. The international community speaks about strategic development goals, SDGs, etc. So where is that? Where is everything? It's really I don't know. It's really strange, and then for other people, denial could be a defensive mechanism. I was at Abu Yusuf al-Najjar Hospital in Rafah. And we were burying a couple of young children, actually. One was 17 and the other was 14, who were killed because they wanted to, they were in a building where the internet is available. So the building was bombed and they got killed. And these are like two sons, actually the only two sons of a relative. And at Abu Yusuf al-Najjar, I saw another cousin, not immediate cousin for my family. And he looked at me and he said, you know what, at least they have buried their sons. My son was buried in the shelter in East Khan Yunis, and I haven't seen him, neither when he got killed, nor how he got buried. And I don't know if I'm going ever to reach that grave or not. He was asking questions. He was not informing me about his feeling. And at the same time, he was telling me that those people are lucky, despite that they lost their children, but still they have managed to bury them the right way. We tried in the report to just put the right title to things. But I think we are going to revisit this report again and again in the future. And maybe we'll find that there are things that we haven't really described well and we haven't really gone deep enough. But let's keep in mind that the report was prepared and done when the war is going, when the things were going, and the team that contributed were working day and night despite all the difficulties, So denial is there. It could be helpful at the moment, but there will be some moment in time when denial is gone and people will face the realities that they are living or that they are going to live in.
Yeah, we're going to move on to thinking about children in a minute, but I just wanted to say denial from the international community and the relationship of that to anger at the way in which this is allowed to go on and the world is allowing it to happen. And that anger is very directly and properly directed at all of us on the outside, no matter what we do. we should all experience the anger and feel shame, even though many of us, I'm sure everybody here, is doing everything they can to protest it.
No, if I could add to that, in 2022, no, in 2021, actually, November 2021, we looked into the main feelings that people have after the 2021 attacks. And the three main feelings were anxiety, depression, for more than 80%, and 75% of the people had anger. So anger was already there. We really didn't look into the reason of that anger. We didn't ask people, but of course I would leave it to your imagination to think why people are angry, and then of course to think how that anger is going to show itself on the population.
Yes, I wonder if we could move on to think very specifically about children. Lemma has given some of the utterly horrendous statistics about the deaths and the suffering and the disabilities inflicted upon children, and I won't repeat those. But I was just thinking about Felipe Lazzarini said, this is a war on children. It is a war on their childhood and their future. And I thought, we know we have the evidence of children being deliberately targeted by doctors who've worked in Gaza, have spoken about that. And of course, children in a settler colonial society are not meant to have a future. They are a demographic threat. They are seen as not part of the future that the settler colonial state imagines for itself. So I just wanted to ask a bit about how we think about children specifically. One is, as I know from the Palestine Trauma Center, even in the middle of the horror that's being inflicted on people, there are a lot of interventions going on to support and help entertain children, give children some brief moments of childhood, of pleasure. Those things are going on. And so any intervention that enables children to have that temporary relief that impacts them is absolutely crucial. But I just wanted to pick up on a couple of things, both from the report and from our recent conversation. I mean, the first one is, and I would totally agree with this as a family therapist, that probably the best way to help children long-term is through the psychological support of their parents, because parenting capacities are so diminished in the current circumstances. It can't be anything else. All of us would be diminished in our parenting in these circumstances. So I wonder if you could just say a bit about that, about the need to support parents in their parenting.
Well, it's one of the things that kept happening, and this is good. I mean, during the some recreational activities were made to make the children have 30 minutes or 1 hour of cheerful time, which is really good. It changed the mood for the children and thus for their parents, and suddenly some moments of happiness among this miserable time. But also, during our practice, I mean, we understand that although we can stay with the children in the therapy room, for example, for a couple of hours per week, or for like a couple of sessions per week, our intervention would still be minimal compared to what the parents can do, compared to the time, for example, the parents spend with their children. And that's why parents were all the time an important part of the intervention that we apply for the children, whatever the intervention we apply. And I can give an example that I all the time give, and I repeat it many times, but unfortunately, the conditions are repeating themselves even worse this time. You know, when you speak about a child who is 7 or 8 waking up in the morning with his clothes wet, you know, what can you do about that? Some of the parents will start yelling at the child. What have you done? Do you feel that you are small? Are you 2 or 3 now? You know, he could be by sometimes beaten up by some families, you know, because the parents don't understand why the child have done that. And when the member of our psychological first aid team, for example, visits by a chance, and they tell the information to the parents that this means that fear, psychological exhaustion, neurological exhaustion can lead or cause any races bedwetting, and give some small tools on how what can the parent do in order to help the child reduce these frequencies of bedwetting and maybe recover. There is a totally change in the mentality of how parents deal with the children. A different issue is children become disobedient. They become irritable when they are young. They become.
I just wanted to interpose an expression you used about bedwetting, which I found very powerful, which is that it's the bladder weeping.
Children weep through the bladder. This is not my expression. I read it once, but I like to use it all the time.
We were going on to talk about disobedience.
Yeah, the disobedient children become very irritable. They can't still stand still. They are really extremely afraid. They can't express themselves when they are 3 or 4 or 5. They are shaking. And sometimes when the parents tell them to bring this thing or take that thing or take off their clothes or put on some clothes, they don't really listen. They don't hear. Maybe they don't hear you at all, you know. And sometimes the parents, unfortunately, start to respond aggressively to that. You were such a kind child. Why you don't hear us anymore? You are not good anymore. And that's that kind of word that could really further complicate the mental health of the child, because now the child feels not only being not a good child, but also he is becoming or she is becoming shameful of how the behavior is happening. And then you need to educate the parents what they can do, what they should do. Our PFA teams, we managed to send with them what we call PFA kits, and these are composed of 2 main things: stationery and toys. And to our surprise, or maybe not surprise, but to our luck, the parents who received those kits were extremely happy to receive them because they found something meaningful to their children. Let's keep in mind also that the people in Palestine at large, in Gaza Strip, they have the highest level of education in the Middle East and maybe in the world, you know. So it's easy to train them something, to tell them something, and they will immediately digest it and start working on that. That's why simple information can make a big difference in the life of the children when the parents get more and more involved. So it's very important to keep that in mind. It's very important sometimes even to show that the parent what does it mean to play with a child. When our psychologists sit on the mattress in the ground with the child and start playing with children, then the mother and the father, they will see what does it mean to play with a child, and not to see the child playing and do something else when you are both in the same room. So I mean, there are some little things that you can do, but they make a big change, and they have an important preventive intervention, and they prevent further deterioration of the psychological well-being, and they support children get rid of the feeling of shame, the feeling that they are not, for example, worth it, and the feeling of the parents that we cannot do anything to help our children and to help our people around us.
Thank you. And in relation to this being an assault on children, and the phrase that our colleague Nadra Shalhoub-Kevorkian uses of unchilding, of children being removed from the domain of childhood and thrust into the domain of being a threat. I also wanted just to touch on something we discussed the other day, which is clearly it's understandable that we all feel most outrage on behalf of children. But there is a risk perhaps that when children are constructed, as indeed they are, as the innocents, there is a problem about how that leaves the rest of the population constructed. So when children are highlighted, as indeed they should be, what does that lead to in terms of saying, so are the rest of the population not victims? Are they not innocent? What does that do to our discourse? I wonder if you could just maybe speak to that for a minute or two.
Well, all the time people ask how are children doing. I think first people sympathize with the children. I think this is because people see photos that come from Gaza Strip and from Palestine, and they see how our children are really lovely, like all the other children in the world. Future, at the same time, into their own children. And it comes to their mind, the children of Palestinian people, then they start to think, how are those children living? We adults, we don't talk a lot about our own emotions, but we like all to focus on children. Maybe it's easier. But at the same time, when everyone is only talking about how it's unjust to children, come on, people, I mean, it's unjust to all inhabitants in Palestine. I mean, colonial, let me say, actions, the occupation, the onslaught, the ongoing attacks, the previous attacks, what happens in the West Bank, what happens. I mean, this is all targeting the whole population. Perhaps it's easier. Maybe I am less afraid when I say help the people, help the children in Gaza. Maybe I'm afraid to say, and this is another question. I mean, the international community needs to understand that the victims in Gaza are not only the children, the whole population are victims of what's going on. And it's not like, children deserve to have a better life. Only children deserve to have.
Absolutely. Sorry, I think you broke up very slightly there.
Of our children will be better one. And we hope that the international community.
I think that's such an important point, Yasser. And the report, of course, also spoke about the sexual violence and torture visited upon men and women. And I hope that will come up in the discussion, because we're coming to the end of our time and we need to give time for the audience to ask questions. So I just wanted to just ask, well, two other questions really. One is how you think the team has been able to act in such a steadfast, professional, effective way in the midst of such horror and such fear and such personal loss. Are there particular aspects of community, of faith, of a professional ethos that you think are supporting them? Is there something you'd like to highlight?
Well, first, I mean, GCMHP staff are known to be like the beacons when it comes to mental health services. So when they were displaced with the others, whenever someone had a problem, they would really find someone from GCMHP and talk to him. And that was happening everywhere, in shelters, in tents, in areas of displacements, in neighborhoods, in buildings, etc., etc. So for quite some time, they were doing their work without even feeling that we are doing something. It was their normal routine life that they are helping the community they are staying in. But I think these, my colleagues are very, really dedicated. There are many risks that happen on their way to work, on their way to the displaced people, on their work to visit the families, the children, but they take that danger and they go on with. I think the organization tried over the years to organize supportive mechanisms, en route supportive mechanisms within the GCMHP, including care for caregivers or supportive supervision. And this is one of the activities that we try to maintain. There are some also of our staff who are receiving some support from people outside Gaza Strip, from the international community. This is happening, but very limited possibilities because of the problem of the communication, the difficulty of internet. So this is also very important. But I think the main issue is that GCMHP has a culture of support and of giving people, and a huge and strong link between the staff. I mean, when I was calling them when we were displaced to Rafah in February, and we started our temporary place in Rafah in February, some of them, they came immediately. Some of them took them 2 to 3 days to come. They said in the beginning, this is crazy, you know, what are we doing here? We should be with our children, with our families. But 2 or 3 days, they were in the front line. They were the very first people. They felt, they had a feeling of agency, you know, and this is very important. The most rewarding feeling that my staff has is when they see someone 2 or 3 weeks later, 2 or 3 months later, and they see the gratitude on the face of the mother, the happiness on the face of the child, the gratitude on the face of the father, that you came and helped us in the most difficult times, in the most days. And it's unbelievable. It's unbelievable. A child comes, or a mother comes, and she says, your intervention helped us put our child on the development. So this is something that you cannot really get in different areas and different places. But I think this is what I could explain. But above all, I'm not really certain what really makes GCMHP staff do all of this incredible work. I think some of them are, you know, just their heart are with the population and with the people that's happening. So.
And I think all of us who know you, Yasser, know how much support and sustenance you've been giving to the team at every opportunity you can. And that, in a way, that brings me to the sort of last question, which is the people who are delivering the interventions are, of course, themselves deeply affected, deeply traumatized, but continuing to work is also a means of having agency in this situation where it's hard to feel any agency. And so I just wanted to take that a bit forward to your recommendations. Clearly, your recommendations are that the only solutions are political. There has to be a ceasefire. There has to be a future for the people of Gaza to live in freedom and dignity. But I think in terms of mental health interventions, it seems very clear that rather than having a lot of experts piling in from outside when conditions allow, it seems to me that the crucial importance is capacity building within Gaza and an ability to support the enormous resources you do have, because you have a lot of people who've trained in psychology who maybe need supervision, but who could deliver the work if they were given the support and the means to do that.
But training people is very important. We have, I think, 3,000 available psychologists who need to receive good training and start working. As all the time does not lack human resources, actually. We lack means to allow people to work, do the job. I think one important aspect that international can help is with the training, with the education, supporting the young people start working here and there with different organizations. And I think the mental health interventions will be hopefully given the needed priority in the near future. And there will be a lot of work to do for everyone. For people who are interested to visit Gaza from the national community, please make sure that you understand the culture, and please do your, sorry to say it, but do your homework and understand what really happened in Gaza. Because if you are going to ask a silly question someone who was in Gaza for 10 months, the reaction is not going to be good. We are very transparent people, Palestinians, and we say things in the face. You might hear something that you don't like, really, but you know this, Gwyn, but I'm not going to say more about that. And it's better to be equipped, If you are going to deal with people who are surviving a genocide, then please know what you are going to do. I know that out of solidarity, many people would really go there, but this is really appreciated. We thank you very much for that. But when it comes to intervention, let's remember that this is health. Would you really prescribe a medicine if you don't know what's the diagnosis, if you don't know what's the best treatment for?
I just wanted to add something to your message to those outside, is also that everybody in Gaza feels they have been abandoned, isolated, and nobody from any organization that hasn't taken a clear stand against the genocide would have any business believing that they can intervene. So I just wanted to speak about the moral injury on top of all the other injuries that is done by professional communities in the US, in the UK, who have not spoken out. So I think maybe we will leave our conversation here, Yasser. It's been such a privilege to speak with you. And I've learnt, as I always do, such a huge amount from speaking with you. And we're going to move on to questions from the audience now. And I think Emma will address the first question.
Actually, thank you, Gwyn and Yasser. I don't know, my heart shudders all the time. And yet, Yasser, you give so much hope. Before we move to Q&A, I want to give a moment for Nancy Murray, the president of the Gaza Mental Health Foundation, to say a couple of words.
Thank you, Lama, and thank you so much, Yasser and Gwyn. That was indeed a heart-wrenching but necessary conversation. So the Gaza Mental Health Foundation, which is a US 501c3, which has been around since the year 2001, has been supporting mental health work in the Gaza Strip through collection of funds and making sure that programs like GCMHP and the women's groups, which it gave birth to, are able to continue to function. So I would just urge people, if in answer to the question, what can be done? One of the things that can be done is making a donation. I know many of you on this webinar already have, and for that, we are very grateful. For those of you who don't know our work, you could go up to the top of the chat and see where our website is listed, gazamentalhealth.org. There's the PO box given for checks, and you could go on to the website. There's a donate button, and you can donate online. Now, we're often asked, but how does the money get there? And I just want to say that to date, we have been successful in using transfer from our bank account to bank accounts in the Gaza Strip, and we know that they have all arrived safely. So for the time being, that is how money has been sent, and hopefully it will continue. Our trustees pay all the overheads. We're a volunteer organization, so all of your funds go 100%. They'll be forwarded to the Gaza Strip. So thank you, and let's hope this horrendous genocidal nightmare is soon over. Thank you.
Thank you, Nancy, very much. So it is time for Q&A. And I know a lot of you, posted questions before. I'm trying to scroll back. If you still have your questions, do please post them and put the letter Q before your question. So I'm going back, and here's a question from Maxine Fuchson. How can the therapists intervene with parents who are hopeless and not having the ability to keep their children safe? How to deal with that primary need for parents to feel they have the ability to truly assure safety when that has been taken away from them?
Maxine, great to hear from you. And look, I'll give you a simple answer. Maybe it's not the right one or the best one, but it's a simple one. If we would think of things like that, we wouldn't really be at least working at all in GCMHP. We have all the time to challenge the realities and the conditions and try with the parents to challenge the realities and the conditions. We were training and teaching parents where to find a safe place. And safety, as we know all, it's 100% not there in Gaza Strip. People who were asked to flee from the eastern side to the what's called safe zones, some of them were burned in their tents, and we know this already. Some schools, shelters were bombed and targeted. But we need to have moments when when our mind has some moment of peace, and we have to pass that peace to the children, because we cannot continue to be all the time fearful. We cannot survive like that as a human being. We cannot survive like that. So whenever you find someone who's going to a place, okay, this place could be a little bit better. It's in the safe zone. We can stay tonight. We can feel that things are fine. The bombardment is happening, but it's far away. You have to try to keep all the time talking to the kids, the children, that despite that you hear some bombardment, it's far, it's not near you. And when something, God forbid, happens near you and you just manage to escape, well, we escaped. You need all the time to, unfortunately, just enjoy that you lived today. That's something that you sometimes, the only thing that you have in hand, that I survived what happened yesterday. So this is why a big task that we struggle with is to make people think about tomorrow. What can we do to help each other, to help our children, rather than to think on what happened yesterday and how unsafe the realities are, how unsafe the conditions are. Yes, as a father, I could think of how unsafe things are, but maybe I should act in a clever way, not to disseminate my fear to the children, not to let it get into the hearts of the children, into the minds of the children, And maybe if I am more capable, then maybe find them something that they could spend their day having some distraction from the realities that they live in. That's why we have seen, and sometimes hundreds of people who went to the sea, swimming in the sea, salty water, when there is no other water that you can wash yourself and your body. Imagine that. You never mind staying in the salty water for a few days until you get some clean water to have a shower, because it feels well, it feels good. And that's the only good thing that you have. And for decades, we all know this, sea was the only, let me say, escape that Gazans have. And during these circumstances, it continues to be there.
Yes, I wanted to pick up the next question, but just before that, I wanted to say what incredibly powerful comments have been posted, and many of them are not questions. They're reflections on people's own experience, people's emotional reactions, and they really are both heart-rending and heartwarming, I would say. The question I was going to ask is from Hubert Murray, and it's about that other aspect of genocide, which is scholasticide and educide, and asking about how much of the education infrastructure is left, how many teachers are left, and how does GCMHP work with teachers, saying that in his view, school is as important, an important breakout from the family tent.
I don't have the exact numbers, but most of the schools, all the universities in Gaza Strip are destroyed. And I think the percentage of the destroyed schools is not far from the buildings, you know. The biggest issue also is that when a ceasefire is reached, and hopefully this will be soon, people will not be able to leave the schools because that's the only place that they can stay in. So there's a big question about how to resume school activities or educational activities when a ceasefire is reached. And this is not going to be an easy problem to solve. Yes, teachers were among the ones who got killed. Physicians were among the ones who got killed. I mean, when you speak about 5% of the population being killed or injured, then you can imagine that it's almost all people got, I mean, from different disciplines, you know. GCMHP started working with schools since many years, over I think 2 decades ago. And that was through working either with school counselors or with school teachers, you know. 2 decades ago, the number of school counselors per schools were very minimal. I think now in Gaza Strip, we have about 1 school counselor per school. But let's keep in mind that we have about 600 to 700 children per school. So imagine that 1 school counselor per 600, 700 children just going out of this, of these circumstances. So a lot of our work was on empowering the school counselors, training the school teachers on just, let me say, providing some simple containment, if we could say, interventions that could not really further make the lives of children in schools more difficult and more difficult. And let's keep in mind that the 3 main difficulties that children have in schools are related to trauma. It's bedwetting, it's peer relationship aggression, and the 3rd one is low school achievement. And these were reported for decades now, that these are the main difficulties that the education system talk about. And that's why the mental health intervention within schools is very important. Luckily, again, now we have in each UNRWA school, we have at least 1 school counselor, and in each Ministry of Education school, there is at least 1 school counselor. But at least that number has to be tripled, in order to be able to provide something to the children and the kids. Of course, the interventions at schools can vary from various recreational activities to some group interventions, and ending it with individual therapeutic intervention that could happen at the school counselor office. And for more difficult cases, they can be referred to our GCMHP community centers.
Thank you, Yasser. There's another question. How do you see the ongoing genocide going to affect the current generation in the future? How the psychological aspect could lead to a new generation that we cannot blame in the future of whatever they will do without political solution and intensive psychological support to treat their trauma?
This is a very difficult question to answer. And I think in one hand, time will show us how the people are going to respond. I don't want to be pessimistic. I want to be optimistic that we as Palestinian people will have the power and courage and braveness to overcome the current realities, to go back to functioning, and to be able to rebuild our homes and our Gaza Strip and move on with our life. That's my hope. That's my optimism. And I think it will be, because we are who we are. On the other hand, let's look at our grandmothers, survivors of Nakba. We will see ourselves talking like them maybe in 20 years from now, maybe in 30 years from now, maybe more from now. We are going to have our stories to tell. We are going to tell about the stories that we have heard from our grandparents. And then we are going to tell the stories of the things that we have seen. and then we are going to compare between both stories, and then we are going to pray that a third story will not see the light. I think that's how it will be. I mean, a third Nakba, of course, not going to see the light.
So the next question is from me. You know, in one of the meetings we had, often we get, you know, the Palestine Mental Health Network, anyone known to have connection with Palestine is asked, what can we do? How can we help? How can I provide support? I think one important point that sometimes people miss, people in Gaza, professionals in Gaza are highly trained. They are very highly trained. And you and I were at a meeting, Yasser, and someone asked, and you know, how can we help, etc. And I recalled something Rana Nashashibi, my friend, says, she would say, you know what you can do? You go, she said, I'm learning how to collect rubble and build homes. So, وتصير بليطة يعني. But so kind of like now what we need is safety, security, etc. But you said something very helpful that you know, I would never have thought of, which is prevention. Could you say a bit more about that?
Well, you know, what I was talking when prevention is that let's not wait until things get worse and worse. Let's start to intervene as soon as possible. And that's the policy that GCMHP applied with this since October the 7th, that we started from the day we could really work on in the society. For the people coming from the international community, I mean, in my opinion, the main thing that they can provide is support the staff working in Gaza, you know, which is providing some form of peer supervision or care for caregivers. But at the same time, they should learn, they should have the expertise in doing that, you know, because sometimes people are inclined to ask about the information they don't know, the information they don't have. And asking 3 or 4 questions might make the whole meeting not that good, you know. I mean, you are coming out of your curiosity, or you want to help me with something. So even providing care for caregivers needs some training or some expertise, and that's why all people in the international community interested, maybe they should take some of those lessons, and these are not difficult really to learn. For our staff to continue to work, let's keep in mind that they are survivors, that we are survivors, and everyone in Gaza will be a survivor, and which means that exposed to everything that, witnessed everything that we are going through or we went through. And then that survivor is now working on helping the others, helping the other survivors to continue their survival. And we are going to continue to live with the problems, which is lacking of power supply, lacking of good water, lacking of sanitation, I mean, even sewage, operating sewage system, lack of good education system, and not in our houses. So it's very important to keep in mind, let's try to support those clinicians, those experts, those MHPSS workers at large, and at the same time help them prevent their secondary traumatization, you know. And then on the other hand, let's try to keep things very professional, you know. Let's not sympathize too much to the level that we start giving money to the survivors, you know, because then this is another dilemma. This is another difficulty that might ruin really the main objective of the relationship that we are building with our clients, you know, or with our colleagues. So this is what I had in mind. I don't know if Lama, if you had something else in your mind, because
no, that's it. Yeah, that's it. That's what I had in mind. Gwyn is going to take over the next question.
Well, this is a question and a reflection really from one of our colleagues in the UK, Jonathan Chadwick, who's done some amazing work with theatre in conjunction with colleagues in Gaza. And Jonathan is really raising the question of the relationship between drama and mental health, and the important role that drama can play, as we've seen many examples of, in boosting mental health. So I just wanted to read Jonathan's post about that. We want to create spaces, creative spaces, that deal with the reality of the experiences of Palestinians. We have an event in London about the prisoners' stories on Thursday, the 15th of August. People can find that in the chat. And I think that interface between drama and mental health is a really significant and important one, and the whole way in which the creative arts can provide support, sustenance, nurturing. Yeah, it's not necessarily something you need to respond to, but it's a very powerful message.
Well, we see the current realities. We understand the realities, the difficulties in Gaza. Drama is used, especially with children, you know, in groups, proved to be effective. But for group interventions to work, organized group interventions, we need some stability. That's unfortunately why we haven't applied psychodrama, for example, at the moment. But this is among the 3 main interventions that we apply with children at GCMHP. The first one is play therapy, the second one is art therapy, and the third one is psychodrama. And it's good because it's in groups, and children really become very active and talkative, and they just express themselves in a very nice way. And we have experienced psychodramatists, and even we have experienced trainers, certified trainers on psychodrama. GCMHP has accumulated huge expertise over the years. We have trainers on supervision, for example, care for caregivers, certified trainers on care for caregivers. We have certified trainers on psychodrama for children, or what's called symbol drama, you know. So, and we are running a high diploma in community mental health that is now on hold until the academic system is returning, you know. So we do a lot of work, not only at the level of intervention, but at the level of knowledge exchange and building the capacities of other workers in the field. We managed, and as the report showed, to even deliver training activities to the stakeholders in Gaza Strip. My colleague Rawi Hamam, who is the head of the training research department, I think she was here for some time in the meeting. I saw her a couple of times. She and her team are really doing well in that, despite all the difficulties. And people, they come to the training, they want to know how to do, for example, PFA in a very professional manner. They come, they learn from GCMHP, and then they do to the field and do their work, you know. So it's really a very nice hub, GCMHP, in order to disseminate the knowledge. And then let's keep in mind that GCMHP, for part of its activities, was to standardize the interventions and make sure that they become culturally acceptable, culturally adapted, which is very, very, very important. And the next, I think around mid-August, we are planning to have a small symposium with the colleagues. We are going to talk about 3 interventions and think whether we can introduce them to the staff. One of them is EMDR, one of them is narrative therapy, and the third one will be a refresher course on CBT for traumatized people. So we are looking into things despite the current realities, but we are still thinking what else we can add to our bag of interventions that help people. It's not an easy work. It's the circumstances, the conditions are very difficult. And that's why we need your support one way or the other. We need to have your expertise one way or the other. And of course, above all, we need to have peace. We need to have justice. We have to live in dignity. We have to enjoy our lives like the other people. We have to see the respect of human rights and into the human rights violations in Gaza Strip and in Palestine at large soon.
Thank you very much, Yasser. Thank you, Gwyn, for being here. And my sincere apologies, everyone, that we can't read all the questions. The meeting will be recorded, is being recorded, and a recording will be emailed to everyone who registered. And as we reach the conclusion of our meeting together today, I want to leave you with a final thought to second Nancy's call. Each contribution you make is not just a donation, it's a lifeline, a vital support to those facing daily atrocities in Gaza. Despite the gravities of these challenges, there is hope, hope for wounds that might otherwise last a lifetime. And, you know, I've been involved in many organizations, and the Gaza Community Mental Health Program, you know, 100% of what you donate goes to Gaza. There's no administrative cost or anything like that. And if you are in the US, it's tax deductible. So let us stand together, not just for the good we can do, but for the profound healing and impact we will have. And thank you all for your compassion and willingness to make a real difference. Have a beautiful day. Thank you.